This is my rectal lab video. So first thing, we're going to want to verify our MAR to our doctor's orders. So I can see here the same name, same date of birth, proper medication was transcribed. So we can move on and we can start with our 5 rights. So we're going to do our 3 checks at the same time. And we're going to compare. Well, the first check here we're going to do when we pull our medication from the medication drawer. So I have my MAR here as well. I've got a label on my suppository. So Rectal suppository, 10 milligrams, Patrick Cowley, right root, PR, which is per rectum. Right time, so 3 times a day. Today it's 9 a.m., 3 times a day. Alright, so then we can go ahead and do our second check as we're preparing it. But since this is a suppository, there's not much to prepare. It's just in its own little wrapper. So we'll do our second check. Rectal suppository, 10 milligram, 10 milligram, right patient. So Patrick Cowley, right root, PR, right time, 9 a.m., 3 times a day, 9 a.m. Okay. So then we can do our third check while we're gathering our supplies. So today I have my suppository, I've got my lube, I've got my towels and sheets that I would need for that. So while I'm doing that, I'll do my third check for my MAR versus the label. So Rectal suppository, 10 milligram, Patrick Cowley, PR, 9 a.m., 3 times a day, 9 a.m. Alright, so we can go ahead and head to the patient's room at that time. I've got my tray here. So I entered the patient's room. So hello, my name is Monique. I will be your nurse today. I'm just gonna fix this. Alright. So I would provide privacy for my patient, make sure all the doors, curtains are closed, etc. At this time I could also do my hand hygiene. So I'd go over, wash. I'd put on a pair of clean gloves too. And then I'd go ahead and ask for full name and date of birth from our patient. So Patrick Cowley, May 26, 1977. Okay. And then so I'd go over, I would say, okay, your chart looks good. The normal vitals, they look pretty. They're within range. We can note that Mr. Cowley has dehydration, so we'd want to make sure with the suppository that he's taking an extra fluid. Any allergies, Mr. Cowley? So there's none known on the chart, so we just make sure there's still none that we're aware of. We go over the right reason with our patient. So Mr. Cowley, the reason we're taking the Rectal suppository today is to treat constipation. So it's a stimulant laxative that increases the amount of fluid and salts and waters in our intestines, and that'll help move things along. Our charts here and our records show you haven't had a bowel movement in 3 days, so that'll help you feel more comfortable and get things moving for you. We do want to go over the right education with our patient as well. So Mr. Cowley, just so you know, this will typically result in a bowel movement from 15 to 60 minutes. So hopefully we want to just keep encouraging the drinking of water, especially with this kind of laxative that promotes water absorption in the intestine. So we can also discuss if the patient would like to do it themselves, if they're capable and they have the ability to, etc. So at this time, I will be doing it for the patient. And then we just want to go over the side effects. So Mr. Cowley, this could lead to some mild abdominal cramping, the urge to go have a bowel movement, diarrhea, and possible skin irritation around the anus. So they're aware. Mr. Cowley, you always have the right to refuse the medication, so we make sure they know this as well. So I'd go ahead and I'd start by putting our rails down on our bed. And then I'm going to assist our patient best I can into the Sims position, so that's on our lateral left here. Alright, turn my patient. I would make sure their right knee is bent and pushed up a bit. So at this time, what I would do is I would make sure that there's a nice blanket and our patient is as comfortable as possible. Okay, I would drape the patient best I can, just so only the buttocks is showing. so they're exposed and comfortable as possible. So at this time, what we're going to do is we're just going to do a quick examination of the rectum and make sure look if there's any hemorrhoids, any rectal bleeding, the skin around the anus, see if there's any skin breakdown that needs to be addressed. So at this time, I would also put my waterproof mat under the buttocks just to prevent any sort of wrecking the linens underneath. Alright. So at this time, I would grab my suppository, I would open it up. Note that we should do this before we open the lube, so it's not so slippery for us. I would just make sure our patient's comfortable. I've explained what's going on to them. Mr. Cowley, I'm going to put this into your rectum at the time. You're going to just have to relax and breathe through it. Shouldn't be painful. Let me know if there's anything or if you need me to stop. Just make sure that air of communication is open. So I'd open it. I would then open my lube and I would put lube on the suppository and on my dominant hand on the index finger. So make sure there's lots on there so that there's no discomfort for the patient. So then I would instruct the patient to just take deep breaths to try and relax that anal sphincter as best they can. And then I would take my dominant hand, I would spread the cheeks and insert with my index finger. Okay, and I would want to make sure that it was 4 inches about past the inner sphincter. Okay. So at that time, that's in. I could go ahead, take a clean cloth, and I would just wash the anus just a bit to make sure that's nice and clean. I would take all my garbage. I would take all my linens with me here. Make sure my patient. Right. I would dispose of my gloves at this time as well into the trash. I would gather all my stuff, making sure I'm keeping it as clean as possible. Okay. So at this time, I would just make sure my patient's comfortable. I would instruct them to stay on their back or preferably on their side for about 5 minutes, just to let that medication absorb. So I'd explain that to them. And of course, I would be doing hand hygiene after this, applying new gloves if need be, but I should be pretty much done. I would be making sure the patient has access to the call bell. I would let them know that they should be feeling that urge of BM, and bowel movement, in that 15 to 60 minutes. So depending on the situation, they could, if they're able to make it to the washroom themselves, you would want to instruct them that they need to not flush, so we were able to look at it and measure it if need be. If they need assistance, they need to be aware they need to press the call bell and let us know when it's time to go. If they're quite incontinent, you would want to set them up under some clean waterproof pads, etc. Make sure they're comfortable. I'd put the rails back up when I'm done here. Okay. So, and then I'd be all done. I could take my stuff with me, as long as the patient is good. So I would go and make sure I have the right documentation. So I take my MAR. So I've got the 2 collax, 9 AM, and I would sign here. So, and I would be sure to record any assessments I found about the skin or anything notable. The right evaluation. So I'd be going back around 5-10 minutes, etc., doing my rounds. I just want to see how they're feeling. Had it worked yet? Were they able to have a bowel movement? Are there any adverse effects we should know about? Is there any cramping or anything that shouldn't be happening? And at that point, you'll know if it needs to be repeated, as the doctor orders. It was 3 times a day, so it's very possible. And that is it.